ಅಪೋಲೋ ಹಾಸ್ಪಿಟಲ್ನಲ್ಲಿ ಕರ್ನಾಟಕದ ಹಿರಿಯ ನಾಗರಿಕರಿಗಾಗಿ ಸೀನಿಯರ್ಸ್ ಫಸ್ಟ್ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಚಾಲನೆ. ಹಿರಿಯರ ಆರೋಗ್ಯಕರ ಸಂತೋಷದಾಯಕ ಸ್ವತಂತ್ರ ಜೀವನಕ್ಕಾಗಿ ಕೈಗೆಟುಕುವ ಸಮಗ್ರ ಸೇವೆಗಳು. ಬನ್ನೇರುಘಟ್ಟದ ಅಪೋಲೋ ಆಸ್ಪತ್ರೆ ಹಿರಿಯ ನಾಗರಿಕರ ಆರೋಗ್ಯ ಖಾತ್ರಿಗಾಗಿ ಸೀನಿಯರ್ಸ್ ಫಸ್ಟ್ ಸಮಗ್ರ ಆರೋಗ್ಯ ಸೇವೆ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಚಾಲನೆ ನೀಡಿದೆ. ಕರ್ನಾಟಕದ ಮೊದಲ ಈ ಸಂಯೋಜಿತ ಆರೈಕೆ ಕಾರ್ಯಕ್ರಮವು ಹಿರಿಯ ನಾಗರಿಕರು ಆರೋಗ್ಯಕರ ಸಂತೋಷದಾಯಕ ಮತ್ತು ಸ್ವತಂತ್ರ ಜೀವನವನ್ನು ನಡೆಸಲು ಕೈಗೆಟುಕುವ ವಿಶೇಷ ಸೇವೆಗಳನ್ನು ಒದಗಿಸಲಿದೆ. ಅಪೋಲೋ ಆಸ್ಪತ್ರೆಯು ಈ ಕೈಗೆಟುಕುವ ಆರೋಗ್ಯ ಸೇವೆಯನ್ನು ಶ್ಲಾಘಿಸಿದ ಸಚಿವ ದಿನೇಶ್ ಗುಂಡೂರಾವ್, ಹಿರಿಯ ನಾಗರಿಕರಿಗೆ ಸುಧಾರಿತ ಮಾತ್ರವಲ್ಲದೆ ಸುಲಭವಾಗಿ ಪ್ರವೇಶಿಸಬಹುದಾದ ಆರೋಗ್ಯ ಸೇವೆ ಖಚಿತಪಡಿಸಿಕೊಳ್ಳುವಲ್ಲಿ ಅಪೋಲೋದ ಸೀನಿಯರ್ಸ್ ಫಸ್ಟ್ ಒಂದು ಪ್ರಮುಖ ಹೆಜ್ಜೆಯಾಗಿದೆ ಎಂದು ಹೇಳಿದರು. ಆದ್ಯತೆಯ ಸಮಾಲೋಚನೆಗಳು, ಪ್ರವೇಶಗಳು ಮತ್ತು ಡಿಸ್ಚಾರ್ಜ್ ಬೆಂಬಲ, ವೈದ್ಯಕೀಯ ಮಾರ್ಗದರ್ಶನ ಮತ್ತು ಹೋಮ್ ಕೇರ್ ಸೇವೆಗಳಿಗೆ 24x7 ಪ್ರವೇಶ, ತುರ್ತು ಸಮನ್ವಯ ಮತ್ತು ಸಹಾಯ ಯೋಜನೆಗೆ ಚಾಲನೆ ನೀಡಿ ಮಾತನಾಡಿದ ಅಪೋಲೋ ಆಸ್ಪತ್ರೆಯ ಕಾರ್ಯನಿರ್ವಾಹಕ ಉಪಾಧ್ಯಕ್ಷೆ ಡಾಕ್ಟರ್ ಪ್ರೀತಾ ರೆಡ್ಡಿ, ಹಿರಿಯ ನಾಗರಿಕರನ್ನು ಮಾತ್ರವಲ್ಲದೆ ಅವರನ್ನು ನೋಡಿಕೊಳ್ಳುವವರನ್ನು ಸಬಲೀಕರಣಗೊಳಿಸುವ ಮಹತ್ವವನ್ನು ಒತ್ತಿ ಹೇಳಿದರು. ಸೀನಿಯರ್ಸ್ ಫಸ್ಟ್ ಎಂಬ ಯೋಜನೆಯೊಂದಿಗೆ ನಾವು ಕುಟುಂಬಗಳು ಮತ್ತು ಆರೈಕೆದಾರರಿಗೆ ಆರೋಗ್ಯ ಸೇವೆ ನೀಡುತ್ತಿದ್ದೇವೆ. ಹಿರಿಯ ನಾಗರಿಕರು ಸ್ವತಂತ್ರವಾಗಿ ಮತ್ತು ಗುಣಮಟ್ಟದ ಆರೋಗ್ಯದೊಂದಿಗೆ ಬದುಕಲು ಸಹಾಯ ಮಾಡುತ್ತೇವೆ. ಜೊತೆಗೆ ಅವರನ್ನು ಆರೈಕೆ ಮಾಡುವವರ ಮಾನಸಿಕ ಶಾಂತಿಯನ್ನು ಖಾತ್ರಿಪಡಿಸುತ್ತೇವೆ ಎಂದು ಹೇಳಿದರು. ಲಿಂಗರಾಜ್ ಕೆಎಸ್, ಬೆಂಗಳೂರು.
Defining moment in how we care for our seniors. With the launch of the Apollo Seniors First program, we are not just introducing a new service line. We are reimagining senior care in Karnataka and perhaps India. At Apollo, we've always believed that healthcare goes beyond traditional medicine, it goes beyond treating illnesses. It's about empowering individuals to live fuller, richer and healthier life. And nowhere is this belief more important than when it comes to taking care of our elders. The people who raised us, guided us and built the world we live in today.
On the background of hypertension, chronic kidney disease, he is being managed, he comes to the hospital, gets admitted, treated and discharged. Now he goes home, post-admission, post-discharge, the third day, he is a little breathless, he is a little confused. The wife is all jittery, she does not know how to handle. Her son, her only son, has left to the US because all was well. The last hospital visit was unremarkable. The OPD follow-up was unremarkable. So she's totally lost. Who does she go to? These are stark realities and stories that we hear as geriatricians every day. These patients, they can avail of a doctor's services the next day, but these doctors are probably not very well aligned with the treatment because these patients have a lot of complexities, multiple problems, multiple medications. These are one of the major problems in geriatric medicine and geriatric patients. Each medicine can have an interaction with other medicines. Each medicine can have side effects which are often misconstrued as a new symptom. So unless these issues are very well managed, coordinated well with the other treating physicians, often the treatment is suboptimal. The other problem we often see is frailty. Frailty is defined as a state of vulnerability to a person due to decreased physiological reserves. Because of this, you may find 70-year-olds who are pretty sick, need help for his supports, and you may find this 85-year-old person who is all active and robust. Because it's not the age, it is the frailty level that determines your health outcomes. Now, one size fits all approach does not work in geriatrics. And finally, readmission due to inadequate.
And therefore, Madam is right in her list. Long lectures are not that entertainable, said Dale Carnegie, the great American author of the How to Win Friends and Influence People. He was asked, which is your next book? He said, how to antagonize people and distance friends. And the public asked me, how will you do it? By giving a long lecture. Therefore, I want to be as short as possible. Dignitaries of the dais. I feel honored that you have invited me to share the ideas and to say a few words for them. As a judge of the High Court since last more than 7 years, and as a lawyer before my elevation for 25 years, I have seen the predicament the persons in the evening of their life are placed by the fate, less, more by those who ought to have taken care of them. Our Smritikara said, Pita rakshati kaumare, Bharta rakshati yauvane, Rakshanti sthavire putra. The Smritikara was concentrating more on women. When child, father will look after. Pita rakshati kaumare. During her youth, husband looks after. Bharta rakshati yauvane. Rakshanti sthavire putra. This is very important. Sthavira in Sanskrit is old age. If we live long, we are bound to become old. Nobody can escape old age unless one dies earlier during the earth itself. The greatest disadvantage of modern civilizations, which a great psychiatrist Sigmund Freud, Carl Gustav Jung mentioned, is neglecting the old people because they cease to be productive. They are useless to us. So persons who are in the old days are being ignored, not only in any particular part of the globe, but everywhere this is the reality. Bible says, look after your agent.
Mr. Krishna Dixit, Dr. Madhu Sashidhar, Steve and friends. It gives me immense pleasure to be here on this occasion when Apollo hospitals are rolling out an initiative to make their hospitals senior friendly. I'd like to thank the Apollo Hospital management and Dr. Steve Paul for this invitation. This initiative comes at an opportune time, and as we know, the Indian population is rapidly graying and the birth rate continues to fall. This era is potentially a golden age for the elderly. Information technology and the internet have made information and services easily available for the elderly. Mobility aids have made mobility easier. Healthcare services have improved dramatically to improve quality of life for the elderly, but there are still difficulties in lacunae which I'll come to. Geriatrics as an academic specialty in India is still in its infancy, but is growing rapidly. Just around 15 years ago, there were only 2 academic courses in the country. But now there are about 20 courses, around 70 MD students are graduating every year. And the
So if you look at the past 50 years, in India, a child who was born 50 years back and a child who is born today, the life expectancy has doubled. A child who is born today can expect to live twice as long as a child who was born 50 years back. Why has that happened? It has not happened because of medicine. It has happened because of reduction in infant mortality. We have markedly reduced infant mortality in this country. We have improved sanitation, we've improved vaccination rate, childhood mortality has decreased. Agriculture has improved, nutrition is better. All of this has resulted in a substantial increase in that life expectancy of birth, which means that unanticipated early death has been delayed. Our elderly population is increasing in size. Morbidity, illness has now shifted to the last 2 decades of life. This phenomenon is called the compression of morbidity, which means that the last 2 decades of life are packed with illness. And therefore, it is incumbent on us that we develop mechanisms to take care of patients at the later stages of their life. Now, this is not just the same illness that happens later in life. A myocardial infarction, a pneumonia that happens in the last 2 decades of life is incredibly different from a young person having pneumonia. Our doctors have talked about frailty, decreased physiological reserve, the likelihood of developing complications in the hospital like kidney failure, delirium, and so on. So we need an entirely different specialty to take care of these patients because disease presents differently, behaves differently in the later stages of life. Secondly, there is an entirely new set of diseases that only presents in the later stages of life. Degenerative diseases of the brain, macular degeneration, joint diseases, these do not occur in younger patient populations. These are exclusively diseases of aging. And last,
Sri Krishna Dikshitji, who is the Justice of High Court of Karnataka, and his speech was tremendous. A lot of learning and deep knowledge in the Vedas and mythology, and it was wonderful listening to him. I'd like to thank Dr. Prasad Matthew, Senior Professor, Geriatric, CMC Vellore. CMC Vellore has been an organization which we have looked at with respect for their knowledge and their clinical acumen. And to me, that is definitely the North Star of healthcare, not only in India, but for the rest of the world. Dr. Madhu Shashidhar, who leads with passion and who is our President, Healthcare Services. Dr. Steve Paul, I'd like to thank you and Kashmira together for being the first ones to do it in the Apollo ecosystem. And I think this is targeted at making a difference to people, especially at a time when they really need it. So thank you for being there. And Vishal, the head of our home care, I'm so glad that
eventually be part of your life, and how we take care of that, how efficiently we can look after our elders. That I think becomes a very key component of healthcare. And I think this facility that is being launched here is something that makes healthcare very, convenient to the people who are suffering, who are aged, who are the seniors. And I think that makes a big difference because it makes, when we talk of ease of doing business, we should also think of how we can provide our customers and, not customers, I would say provide our people ease of getting things done, ease of coordinating things. There's so many issues which are connected. And I think in that aspect, this kind of an approach, which looks at it in a holistic way, I think it's not just treating a patient because they have some illness, some chronic disease or whatever, but also how we can give that patient enough emotional support, enough logistical support, so that as you grow older, you need more these kind of support systems. And having someone who is like a points person who will coordinate things for you, who will see that things are being done, or who is monitoring things for you, depending upon the person's disease. Just as you said, there's so many various stages. Some are very fit, some are in between, some are critical. So each person has to be looked at in a different way. Some will require probably.
ಸರ್ಕಾರದ ಮಟ್ಟದಲ್ಲಿ ನಾವು ನಮ್ಮ ವಯಸ್ಸಾಗಿರೋರಿಗೆ ಅವ್ರಿಗೆ ನಮ್ಮಲ್ಲಿರುವಂಥ ಎಲ್ಲ ಏನು ಆಸ್ಪತ್ರೆಗಳಿದೆ ನಮ್ಮ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಬಂದೇ ಬರ್ತದೆ. ಅವರಿಗೆ ನಾವು ನೋಡ್ಕೊಳ್ತೀವಿ ಮತ್ತು ಅವರಿಗೆ ಬೇರೆ ಬೇರೆ ರೀತಿಯಲ್ಲಿ ಆರ್ಥಿಕ ಸಪೋರ್ಟನ್ನು ನೀಡ್ತಕ್ಕಂಥ ಪೆನ್ಷನ್ಗಳು, ಬೇರೆ ಬೇರೆ ಯೋಜನೆಗಳು ಕೂಡ ನಮ್ಮಲ್ಲಿದೆ. ಅದು ಈ ರೀತಿಯಾದಂಥ ಕಾರ್ಯಕ್ರಮಗಳು, ಇದು ವಿಶೇಷವಾದಂಥ ಪ್ಯಾಕೇಜ್ಗಳು. ಇದು ನಮ್ಮಲ್ಲಿ ಸರ್ಕಾರ ಮಟ್ಟದಲ್ಲಿ ಈ ಥರದ್ದು ಇನ್ನೂ ಮಾಡೋದಕ್ಕೆ ಸಾಧ್ಯ ಇಲ್ಲ. ಆದರೆ ನಮ್ಮಲ್ಲಿ ಯಾರು ಬಡವರಿದ್ದಾರೆ ಅವ್ರಿಗೆ ಸಾಮಾಜಿಕ ಭದ್ರತೆ ನೀಡುವಂಥ ಕಾರ್ಯಕ್ರಮಗಳು ನಾವು ಕೊಟ್ಟಿದ್ದೀವಿ. ಮತ್ತು ನಮ್ಮಲ್ಲಿರುವಂಥ ಹೆಲ್ತ್ ಕೇರ್ ಏನಿದೆ, ವಯಸ್ಸಾಗಿರೋರಿಗೆ ಮತ್ತೆಲ್ಲರಿಗೂ ಒಂದು 5 ಲಕ್ಷವರೆಗೂ ಉಚಿತ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದೆ. ಸೊ ಅದನ್ನು ನಾವು ಮಾಡ್ತಾಯಿದ್ದೀವಿ. ಮುಂದಿನ ದಿವಸಗಳಲ್ಲಿ ನೋಡೋಣ, ಆಯಿತಾ?